Colimex tablet, uses, how to take it, side effects, and precautions. Colimex is a widely recognized combination medication used to relieve abdominal pain and cramps, particularly those associated with gastrointestinal disorders. It is commonly prescribed for conditions like irritable bowel syndrome, IBS, and other functional bowel disorders. Colimex is available in various forms, including tablets, syrup, and drops, making it suitable for different age groups, from infants to adults. Its effectiveness lies in its ability to relax muscle spasms and reduce gas and bloating, providing relief from discomfort. Always use Colimex under the guidance of a healthcare professional. What is Colimex? Colimex is a prescription medication available as tablets, syrup, and drops. It typically contains dicyclomine, an antispasmodic that relaxes the muscles of the gastrointestinal tract, and simethicone, an anti-gas agent that helps reduce bloating and discomfort caused by gas. Some formulations may also include paracetamol for additional pain relief. Colimex is primarily used to manage abdominal pain, cramps, and gastrointestinal issues, making it a versatile treatment option for both adults and children. Forms of Colimex. Colimex tablet, suitable for adults and older children. Colimex syrup, a liquid form for children who struggle with tablets. Colimex drops, designed for infants over 6 months to treat colic. What are the benefits and uses of Colimex? Colimex offers several benefits due to its dual action on the gastrointestinal system. Here are its key uses. Abdominal pain and cramps. Colimex helps relieve discomfort caused by spasms in the gastrointestinal tract. Irritable bowel syndrome, IBS. It manages symptoms like abdominal cramping, bloating, and gas. Functional bowel disorders. It alleviates pain and discomfort associated with these conditions. Postoperative gas pain, reduces bloating and discomfort due to gas after surgery. Menstrual cramps, dysmenorrhea, relieves muscle cramps during periods. Colicky pain, effective for sharp, localized pain in the intestines, gallbladder, and urinary tract. Colimex syrup uses for babies. Colimex syrup and drops are used to alleviate symptoms of colic in infants, characterized by excessive crying and fussiness due to abdominal discomfort. They help soothe muscle spasms and reduce gas, providing relief from discomfort associated with colic. Colimex tablet and syrup uses. Colimex tablet uses, primarily for adults and older children to manage abdominal pain, IBS, and gastrointestinal spasms. Colimex syrup uses, similar to tablets but in liquid form, making it easier to administer to children with IBS or gastric spasms. Key benefits. Provides quick relief from abdominal discomfort. Versatile for various age groups with different formulations. How does Colimex work? Colimex works by combining the effects of its active ingredients. Dicyclomine, an anticholinergic drug that reduces the activity of the parasympathetic nervous system, leading to relaxation of the smooth muscles in the gastrointestinal tract. This helps reduce spasms and cramps. Simethicone, alters the surface tension of gas bubbles in the gastrointestinal tract, allowing them to coalesce and be expelled more easily, thus reducing bloating and discomfort. Paracetamol, in some formulations, provides additional pain-relieving and fever-reducing effects. Mechanism. In simple terms, Colimex calms the stomach muscles to stop painful spasms and helps break up gas bubbles to ease bloating, making you feel more comfortable. Colimex dosage. The dose of Colimex depends on whether you're taking tablets, drops, or syrup, and your age or condition. Always follow your doctor's instructions. Tablet. Follow your doctor's instructions regarding dosage and duration of Colimex tablet. It can be taken with or without food, but consistency and timing is recommended. Colimex tablet contains dicyclomine and paracetamol, 2 drugs that alleviate stomach pain and cramps. The medication works by inhibiting sudden muscle contractions, spasms, thus relieving cramps, pain, bloating, and discomfort. Drop. Adhere strictly to your doctor's recommended dosage and duration for Colimex oral drops. Measure the medication accurately using the provided dropper as instructed. Take Colimex oral drops after consuming a meal. The drops contain ingredients that alleviate abdominal cramps and discomfort by inhibiting sudden muscle contractions, spasms. What should I do if I miss a dose? If you forget to take a dose, take it as soon as you recall. If your next dose is approaching, skip the missed dose and return to your regular daily schedule. To make up for a missed dose, do not take a double dose of medication. Do not take more than 20 milliliters per day. What happens if I overdose? Overdosing on Colimex can cause severe drowsiness, confusion, blurred vision, fast heartbeat, or even breathing difficulties. If this happens, seek medical help right away. Colimex side effects. Like any medicine, Colimex can have side effects, though not everyone gets them. Common ones include headache, dizziness, sleepiness, nausea, vomiting, constipation, ingestion, loss of appetite, mouth ulcer, gastric, urine in blood, anemia, tiredness. Rare but serious side effects may include allergic reactions, such as rashes or swelling, changes in blood cell counts, heart rhythm issues, or hallucinations. If you notice anything severe, stop taking it and see a doctor immediately. Precautions and warnings. Before taking Colimex capsules or Colimex tablets, it's important to understand the potential risks and take necessary precautions to avoid complications. Always take Colimex under medical supervision, especially if you have existing health conditions or are on other medications. Who should avoid Colimex? Individuals allergic to Dicyclomine, Simethicone, paracetamol, or other ingredients. Those with conditions like glaucoma, myasthenia gravis, severe ulcerative colitis, or obstructive uropathy. Conditions requiring caution. Kidney or liver disease. Enlarged prostate. Heart disease or high blood pressure. Chronic malnutrition, may require dose adjustment. Age restrictions. Colimex drops are generally safe for infants over 6 months, but only under the guidance of a pediatrician. Colimex tablets are not recommended for children under 12 years of age unless directed to do so by a doctor. Pregnancy and breastfeeding. Colimex may be harmful during breastfeeding and has limited safety data for pregnancy. Consult your doctor to weigh risks and benefits. Alcohol and food interactions. Avoid alcohol, as it increases side effects like confusion and dizziness. Consult your doctor about potential food interactions. Possible interactions with other medications. Colimex can interact with other drugs, so let your doctor know what you're taking. It may affect or be affected by anticholinergic drugs, like atropine. Antidepressants, like amitriptyline. Anti-anxiety medications, like diazepam. Other medicines that cause drowsiness. Also, be aware of any supplements or herbal products to avoid potential unwanted effects. Advice: inform your doctor about all medications, supplements, or herbal products you are taking to avoid interactions. How should Colimex be stored? Store Colimex at room temperature, away from moisture, heat, and direct sunlight. Keep out of reach of children and pets. What happens if Colimex is not stored properly? Improper storage can degrade active ingredients, reducing effectiveness or causing harm if used. Check for signs of deterioration before use.